Bonnie. And this is our attempt to really show how we're in Colorado using data to inform prevention measures, and we're just really excited to get started. I am going to start off the presentation and just kind of give an overview of the data that I analyze, because it kind of sets maybe a foundation. So let me share my screen. Can you all see it? Oh, great. Yeah, so again, hi everyone. My name is Allison Rosenthal, and I work at the Colorado Department of Public Safety in the Division of Criminal Justice. And I will be presenting findings from our report on drug impaired driving using our linked judicial and toxicology data set, which I worked on with my colleague Jack Reed, and wanted to give a shout out that we just published our latest report with our 2019 data. And at the end of this PowerPoint presentation, there's a link to that, so you can go check out some of the findings in more detail afterwards. And in today's presentation, and this presentation will kind of just get us started off on some of the data that we have with impaired driving. So today we'll look at the impaired driving and public safety threat, some of the laws that are useful to understand the data that we'll present today. We'll look at the gathering and some of the complications of the toxicology data, and then look at our methodology for doing our linking between the judicial and toxicology data sets. Then we'll look at some of the results and look at the demographics of DUI, some of the relevant toxicology findings, and then look at some statistics around some of the other outcomes like the crash involvement and prior arrests, and finish up with conclusions. So we're going to start by reminding you all of the public health and safety impacts of impaired driving. And some of this data is still preliminary, but already in 2021, we're seeing an estimated increase in impaired driving fatalities. This 246 fatalities has been estimated so far, and this represents an increase of 16% from 2020's level. And crash fatalities are also up from pre-pandemic levels, so we don't think that this is just a pandemic disruption related trend. And in addition, we had an estimated 6,400 crashes related to impaired driving in 2020. And we're also showing here an estimate of the pervasiveness of risky driving behaviors based on data from the Behavioral Risk Factor Surveillance System. And we have both statistics at the general adult population level and also among those who currently use substances. So an estimated 6% of individuals who reported binge drinking in the past 30 days also reported drinking and driving in the past 30 days. And 18% of individuals who used marijuana in the past 30 days drove after using marijuana in the past month. So all of these behaviors and outcomes highlight the associated harms of the increase in substance use that has been a general theme in SEOW presentations throughout the past couple of years. So our data specifically pertains to the judicial process. So we'll help add some context to these public health outcomes with that data. So before we dive into the report, we just wanted to highlight the legal limits for substance use driving in Colorado. So legal limit for alcohol is also known as the per se level, and that level is 0.08 BAC in Colorado. And because the relationship between marijuana toxicology and crash risk is not as direct compared to alcohol and crash risk, there's no per se level for marijuana. Instead, there's a permissible inference level for delta-9 THC. And this means that in court proceedings, juries can be told to infer impairment if this toxicology level is reached. And that level for delta-9 THC is 5 nanograms per milliliter. And throughout this presentation, I'll refer to delta-9 THC as THC. So we want to start looking at some of the drug testing background and why our analysis of the drug toxicology results is somewhat incomplete. So we are missing data from suspects because they are allowed to refuse testing in Colorado, especially if there's no crash that results in serious bodily injury or death. And this, we're estimating accounts for around 25 to 35% of records. And additionally, Colorado also has breath testing available, and suspects can choose to opt for that as opposed to blood testing. And law enforcement agencies also, it's a lot more convenient for them to do breath testing as opposed to blood testing. And so this limits the amount of information that can be gathered from the toxicology records. And additionally, if a certain, during like roadside screening, if a certain toxicology level is measured, there's also like less incentive to go through with convincing a suspect to do a blood test. And there's also no roadside preliminary testing for drugs beyond alcohol. So this also limits the amount of drug testing we have. So we also wanted to share some developments. So while Colorado does not have a centralized like testing laboratory for DUI toxicology, recent years have are kind of going in this direction. So the Colorado Bureau of Investigation in July 1st of 2019 began offering free and comprehensive toxicology testing services to law enforcement agencies. And so this means that all blood samples that were submitted to our lab got both drug and alcohol testing. This was a major improvement in ensuring the completeness of drug testing records. And in this presentation, we'll start to show some of those impacts we're already seeing. So before we dive into the results too, we wanted to define what a DUI court case is. So any court case that had a DUI charge, which are listed here on the screen, was included. And this can either be an initial charge or an amended charge in later filings. So we also want to provide some give you an overview of our data linking process and data cleaning. So first, we combined the state court filings and the Denver court filings together, and this required some deduplication since some cases could be transferred between county and district court, and also had to merge the two data sets together. Then we also gathered data from the 4 toxicology laboratories that we have listed on the screen. And we also gathered data from the Office of Behavioral Health, which is the data steward for the probation assessments to compare. And unfortunately, there is no common key across all of these data sets. So we had to use an approximate matching method to link all these records together. And so we gather, and this is involving the identifiers that were in the data sets, including name, date of birth, the incident date, and arresting agency. So this process is just complicated and takes a while. So now we'll get into the data we found. So in Colorado, we now are seeing a slight decrease in the DUI case filing rates from 2016 to 2019 data. And in 2019, there were 563 DUI cases filed per 100,000 residents over the age of 16. And for context, this also tracks with the arrest records for DUI. This is gathered by the Colorado Bureau of Investigations. And from 2016 to 2019, we saw this steady decline. And we're also showing the 2020 data. And from 2019 to 2020, we saw a drop of 5,000 records in, and this drop was sustained in 2021. And also want to note that 2021 figures are preliminary as they're still being finalized. So with our next year's report, we'll definitely see some differences in the DUI cases. We also wanted to look at DUI case filing rates by age and gender to understand the burden of DUI cases. So in both males and females, case filing rates peaked in the 25 to 34 age bracket, and DUI cases overall were 3 times higher in men compared to women. And DUI case filing rates are also very correlated with binge drinking. So on this graph, we see an area plot for the binge drinking rates as estimated by the Behavioral Risk Factor Surveillance Survey. And we have the yellow line representing the DUI case filing rates. And the trends were identical. And we see that the highest DUI case filing rates and self-reported binge drinking were in the 18 to 24 and 25 to 34 age groups. We also want to show DUI case filing rates by county, and the counties with the highest case rates were in some of the rural areas of our state, including Gilpin, Kiowa, Huerfano, Clear Creek, and Summit. And among the urban counties, Larimer, Adams, and El Paso had the highest case rates. Turning now to the toxicology records. Here's just an overview of the linking and the toxicology record match. So we were able to link about 61% of court cases with a toxicology testing record. And of those toxicology records, 97% had a screening for alcohol, and 42% of DUI court cases with a toxicology record were screened for marijuana. And this represents a 12 percentage point increase from 2018. And 35% of DUI court cases with toxicology record were screened for drugs of abuse. And this represents a 17% point increase from 2018. So this is already starting to see the impact of the change in the access to toxicology screenings. This pie chart helps to show a breakdown of testing and highlights the testing breakdowns. And on this, we see that 80% of records did not have the drugs testing, unfortunately. So turning now to the BAC toxicology results. On this, we see that 78% of individuals who are charged with the DUI who are screened for alcohol tested at or above 0.08 BAC. And we see that the mean BAC and the median BAC were both around double the permissible inference level. So we're just seeing very high levels of alcohol among people who are tested. So nearly half of individuals who were charged with DUI who were screened for THC tested at or above that permissible inference level of 5 nanograms per milliliter. So in addition, we're seeing that 68% of individuals who test positive for THC test positive for another substance. And the most common drug identified in addition to THC was alcohol. And although we have more limited data on drug positivity for non-alcohol and marijuana drugs, we wanted to show some trends involving the drug categories. So we're seeing a steady increase in stimulant detection over the past 4 years and a decrease in depressants. And narcotic analgesics, which includes opioids, have largely remained stable. We also looked at the top 10 drugs identified, excluding alcohol and marijuana. And overall, we just see generally that stimulants, benzodiazepine, and opioids were the most commonly detected drug categories. And these individual drugs are on this slide. So the most identified drugs were amphetamines, followed by cocaine. The most commonly identified benzodiazepine drug was alprazolam, and that's also Xanax. And we also saw an increase in the detection of opioids compared to 2018, and we had more mentions of fentanyl in particular. Finally, I wanted to end with some of the results related to crash involvement and prior arrest. And this data comes from the probation assessments, which were given to individuals who were convicted of a DUI. And so we don't have data available for all probation assessments associated with DUI convictions. And this could have been due to the timing of the assessments and when we pulled the data. I just wanted to highlight that. So the probation assessments give us the best estimate for prior incidents of DUI, since this has the arrest information. And we see that over a third of drivers convicted of a DUI had at least one prior arrest. And this could highlight the difficulty of really addressing substance use disorders, especially through the court system. Overall, crash involvement was estimated at 26% among these individuals who are convicted of DUI. And we did see some variation by the drug types found. So the highest rates of crash involvement were in individuals who tested positive for alcohol and a non-THC drug, and polydrug with alcohol, THC, and other. Additionally, we saw that individuals who tested positive for THC only had a lower crash rate at 10%. This does not mean that THC use in driving is safe because we don't have the appropriate comparison for crash involvement at the population levels to compare it to. But we definitely are seeing the impact of the dangers of polysubstance use in particular with our data. So in conclusion, impaired driving is a public safety and public health issue, and it's challenging to monitor, but we're definitely seeing some trends even with our data with all of its limitations. And we do see a really strong relationship between binge drinking rates and DUI court cases. And we think that this offers an opportunity to address more of the root causes and making sure that we have policies and programs to really address the excessive alcohol use. And we also wanted to highlight just the dangers of alcohol and polysubstance use, since it's potentially more associated with crash involvement. And thank you. And this has the link to our full report. And with that, I am going to turn it over to Sarah Barkley, who comes from the Colorado Department of Public Health and Environment, and she's going to share with us some data related to her analysis of ED visits and hospitalizations.
Everybody, I'm Sarah, and I'm the injury epidemiologist at CDPHE. I'm just going to share my screen. All right. Can everyone see the slideshow?
Looking good, Sarah.
Okay, thank you. So this is an analysis that I worked on last spring with Christine Dumont. She is another epidemiologist at CDPHE in a different position now, but we looked at hospitalizations related to motor vehicle crashes and wanted to assess alcohol and drug involvement in those crashes. So our primary aim when we started this analysis was to expand on impaired driving estimates by looking at not just alcohol involvement in a crash, but also different types of drugs that might be involved. We also looked at motorists and non-motorists, so we included pedestrians and bicyclists. And we wanted to focus on these non-fatal crashes that resulted in a hospitalization instead of a death, just because there's already a lot of work and interest surrounding impaired driving and fatal crashes. So we kind of wanted to fill in a knowledge gap here. Secondarily, we wanted to investigate polysubstance use in these crashes, meaning using more than one drug or using drugs with alcohol when driving. Impaired driving due to multiple substances is an increasing concern. Allison kind of just touched on this, especially here in Colorado, where cannabis use is legal for adults. So we used hospital billing data from the Colorado Hospital Association. We limited our data set from 2016 to 2019 to identify hospitalized motorists, pedestrians, and bicyclists. And then we calculated the frequencies of alcohol and drug use in these hospitalizations. So the hospitals use the International Classification of Diseases, otherwise known as ICD-10-CM coding system, to identify these incidents. So that's how we identified, people injured in a crash and people also using substances in these crashes. We then wanted to take our analysis just another step further. So we used chi-square and logistic regression to look at any associations between alcohol and drug use in these crashes. It is important to note that not everyone who's involved in a crash is tested for drug or alcohol use. Screening is conducted at the hospital, and then those that appear to be impaired are tested for substance use. We selected for just Colorado residents age 15 and older, since that's, about the age that most people start driving. And we selected for hospitalization records with an ICD-10-CM external cause code for a motor vehicle related injury, and used codes for drug and alcohol involvement recommended by other subject matter experts at CDPHE. And we also worked with some EPIs in other states to kind of put together a list of the alcohol and drug codes that we were looking for. Now I'll get to our results. So here in figure 1, we're just looking at the proportion of people who tested positive for these substances when involved in a motor vehicle crash. So you can see that about 19% of drivers, 23% of pedestrians, and 13% of bicyclists were positive for alcohol and or drug use when they were involved in a crash. Positive for alcohol in this case does mean having a BAC above 0.08. Note here that these categories aren't mutually exclusive. So someone who tested positive for alcohol might fall into alcohol and or drug category. And anyway, this is just why the percentages of alcohol use and drug use don't add up to the percentages of alcohol and or drug use, if that makes sense. Once we focus in on just the people that tested positive for substance use, we see that 55.8% of those people were positive for alcohol, 38% tested positive for drugs, and 6.1% of people tested positive for both. So as I mentioned earlier, we did want to look at a few different types of drugs and their involvement in crashes. So this graph shows us the proportion of people who tested positive for any substance after being admitted to the hospital. And you can see that alcohol is the most commonly found substance and cannabis is the most commonly found drug. This category on the far right, other drugs, that includes things like hallucinogens and psychotropic medications. Finally, we looked at the use of multiple substances in these hospitalizations, and we can see that of those involved in a crash that tested positive for alcohol, 10.4% of those people were using alcohol alone, and 1.1% were using alcohol with another drug. 3.5% of people were using cannabis alone, and 1.3% of them were using cannabis with another drug. Once we ran the chi-square and logistic regression tests to look at any associations between alcohol and drug use by drug type, we did find that there was a significant association between alcohol and cannabis use. We actually found that individuals who were involved in a motor vehicle crash that tested positive for cannabis were 60% more likely to also have a BAC above 0.08 when compared to those who weren't tested or tested negative for cannabis. We didn't find a statistically significant difference among those who tested positive for opioids or stimulants and the use of alcohol. So overall, we found that alcohol and drugs are important players in these non-fatal crashes. We knew there were significant and fatal crashes already. Alcohol is the most commonly used substance again, and cannabis is the most commonly used drug. It's also important to note that nearly a quarter of pedestrians were involved in motor vehicle crashes were impaired. So we'd like to continue to investigate what role they play in these crashes and perhaps increase prevention and intervention efforts to address impaired pedestrians. It might also be interesting to repeat these results in other states or jurisdictions where cannabis is not legalized. And then since this analysis, we have linked crash reports to hospital records, which gives us a more complete look into these crashes, since the crash reports provides just some information that's not available in the hospitalization records. It is important to note that not everyone, again, who's admitted to the hospital after a crash is tested for every type of drug, even if they do show signs of impairment. So that does limit this data. And then the external cause codes aren't required for hospital billing records. So sometimes those are missing. It might lead to an undercount. Finally, just, if you're interested, a quick look at the ICD-10 codes we use to identify people injured in a crash, and a look at the codes for alcohol and drug use that we used as well. And if anyone has any questions, feel free to email me. Yep, there it is at the bottom. And also we do have some motor vehicle data briefs linked on the CDPHE motor vehicle safety webpage that look more into substance use and hospitalized drivers. So thank you, everybody.
Thank you, Sarah. Allison, do you have a specific order? You don't look like you're on mute, but I can't hear you.
Oh, thanks. Sorry about that. Yeah, and then I didn't know if Jenna or Bonnie wanted to go next to kind of talk about to kick off the like prevention piece.
Actually, we're going to have Julia talk a little bit more about binge drinking in Colorado.
Oh, great.
And then I'll go, and then Bonnie, and then we're going to finish up with Michaela, who's going to talk about what she's doing in Eagle County.
Awesome. Thanks, Julia.
Yeah, bear with me for just a second while I figure out how to share this. Okay. Oh, wrong one. All right, can you see these slides?
Yep.
Yes.
Awesome. Okay, so I'm going to talk a little bit about alcohol use in Colorado and then some of the sort of national recommendations for preventing excessive alcohol use and preventing impaired driving. According to the Behavioral Risk Factor Surveillance System, which is self-reported, about 1 in 5 adults in Colorado, 18 and older, reported binge drinking. And just for a little bit of background, we've been talking a lot about binge drinking today. And for anyone who's unfamiliar, binge drinking is defined as having 4 or more drinks on one occasion for women or 5 or more drinks on one occasion for men. An occasion is about 2 to 3 hours. And the way that that definition was created was to try to capture when BAC gets over the 0.08 limit, right? So that's why binge drinking is so important here. So about 1 in 5 adults binge drink. Those adults are reporting on average about 7 drinks each time they binge, and binging about 4 times per month. When we look at young people who reported to the Healthy Kids Colorado survey, about 1 in 6 high school students report binge drinking. About 1 in 3 reported drinking at least 1 drink of alcohol in the past 30 days. And more than 50% say they feel like it's easy for them to get alcohol if they wanted to. So when we look at the literature nationally and internationally, we see that there's a strong association between binge drinking and impaired driving. And Allison and Sarah already sort of talked about that. Preventing binge drinking is one way that we can substantially reduce the risk of impaired driving. So these are not Colorado specific numbers, but when we look at nationally, the literature, we see that about 12% of binge drinkers report drinking within 2 hours of binge drinking. More than 50% of them were drinking at licensed establishments. So most of these licensed establishments are like clubs and bars, not as many restaurants where food is served. They drink about 8 drinks during this binge, which is a lot. And then about a quarter of them reported more than 10 drinks. So now that we know that this is a problem, right, what can we do about it? So the Community Preventive Services Task Force has made some recommendations based on systematic reviews of the literature, looking at what policies or strategies will reduce excessive drinking, which then in turn will prevent impaired driving and other harms related to excessive drinking. And they compile all of this information into a tool online that's called the Community Guide. So their recommendations to reduce excessive alcohol consumption are there's a lot of them. Increasing the price of alcohol is one that is highly recommended for preventing excessive alcohol use in young people, especially. Dram shop liability, or holding the people who are serving alcohol responsible if something happens after the fact. Limiting days and hours of sale, regulating or limiting alcohol outlet density. A lot of these are targeting the accessibility of alcohol, right? And then there's some other ones on electronic screening and brief intervention, which happens at the clinical level. They also have recommendations specific to alcohol impaired driving. And some of the recommendations that they find are there's sufficient evidence based on what we can observe in other countries or in states that have already instituted these policies. We can see that ignition interlocks, having a lower BAC permissible limit for young or inexperienced drivers, maintaining the current minimum legal drinking age, and then some other things around enforcement, like publicizing enforcement action. And then this last one, multi-component interventions with community mobilization. This is really looking at when communities use sort of a grassroots approach and take on multiple of these interventions that we've already talked about are evidence-based. So doing more than one thing is always better than just focusing on one thing, right? And one of the best ways to reduce excessive drinking in young people is to limit the availability of it. And one of the ways to do that is to make it more expensive. So throughout the US, we see that communities that have stronger alcohol policies, like the ones that I just mentioned from the Community Guide, tend to have less alcohol-related impaired driving in both adults and in young people, less binge drinking in adults and young people, fewer alcohol-related homicides and suicide deaths, and fewer cases of alcohol-related cirrhosis and fewer alcohol-related mortality rates. So now I'm going to pass it off to Jenna to talk about what some of the communities in Colorado are already doing.
Thanks, Julia. So as we've kind of talked about, there's of course multiple points where you can address impaired driving, from enforcement to prosecution to treatment. And I think that there are communities working across the state at all different levels. And so we're just going to look at a couple who are working on some of the upstream prevention and who are implementing some of the strategies that Julia has mentioned. So I'm going to highlight just two of these, and then Bonnie and Michaela will talk about a couple others. So Gunnison County is one of our communities who has been looking kind of holistically at the impaired driving problem. And so I put here some of the strategies that they have been working on. They've been funded through the CDOT's Highway Safety Office for the past 3 years and another couple years ahead to work on this issue. And So they started out doing work of educating the community about what excessive alcohol use looks like in their area, just kind of trying to raise awareness, change some misconceptions about that. And they were able to pass social host ordinances to help increase adult accountability for alcohol and marijuana use among young people, because they were seeing a lot of parties. Some were house parties where parents knew and provided alcohol. Some were in more rural locations, but really kind of pulling the onus of responsibility, not just from youth, to kind of a community-wide area. And so they have a consistent policy in Crested Butte and Gunnison. And now they are working to educate the community and increase public support around these ordinances and look at what equitable enforcement looks like on that, because the policy is, of course, only as effective as much people know about it and all kind of take part in enforcing it. They are also working on educating stakeholders and parents on the importance of limiting consumption in public, and something that they're seeing as the pandemic shifts into, what are we going into the third year now, I guess, is kind of wanting to increase alcohol sales, consume in public areas like parks, kind of maybe continuing to loosen some of the restrictions. We saw during the pandemic, there were alcohol deliveries, there were just changes in alcohol policies. And so they kind of want to really highlight the impact that that has on our young people, and as, socially norming continuous alcohol use, excessive alcohol use, and its harm. So just kind of doing some work there. I believe they're going to be mapping alcohol outlets, looking at alcohol outlet density in various areas of the county, and then overlaying some data such as impaired driving crashes and DUIs, and then maybe some other alcohol related crime data, maybe some violence data, to better understand and educate people about the impacts of alcohol, which can then, as you all know, lead to some work around potentially licensing and zoning, and just thinking critically and comprehensively about what does that look like in a community, and what responsibility do businesses have for public safety and health. And then they're, of course, analyzing some Community and Healthy Kids Colorado survey data to continue to integrate our risk and protective factors for youth alcohol use and marijuana use and their connections to impaired driving, so that people are really understanding how substance use, especially excessive use, is connected to things like mental health, economic stability, all of the factors that go into this. Because when somebody gets into an impaired driving crash, it's probably not just happening out of the blue. It's, there's a lot of other factors going on in somebody's life. And so the more that we can understand that and look at systems change across the board, will have impacts. And then they're also wanting to do an equity analysis of their local policies. And so kind of looking at where there might be some additional levers that they can implement at the city, town, or county level to change excessive drinking. And it's so normalized in Gunnison County as it is in many of our areas. So the shift towards this is really difficult. And they have talked about there are, I think, almost no areas for somebody to have sober activities, that even the coffee shops have alcohol sales. And so trying to shift this type of culture is very challenging and requires looking at it from all different dimensions. And then we'll talk a little bit about Chaffee County. Next slide, Julia. And then Chaffee County is doing some similar work. They have also been really interested in passing a social host ordinance. Both of these communities are working with their communities that care coalitions and work groups to try to do some of this work. So Chaffee County has not passed these ordinances yet, but that is something that they are still looking into. And social host ordinances has some evidence towards reducing impaired driving. I think it also has some evidence around sexual violence prevention. So it's kind of a good entry policy for some communities to pass, that then kind of starts the conversation for maybe some bigger level policies and more adult focused policies. They also are working on increasing parents' conversations around setting limits and boundaries on alcohol and marijuana use. We know from Healthy Kids Colorado survey data that young people who say that they have clear rules in their home, as well as just generally, as well as clear rules and guidelines around substance use, are less likely to engage in risky driving behaviors, including driving after consuming or riding with a driver who's been consuming. So kind of just increasing this one little step hopefully will have an impact. And then like Gunnison County, they're working to decrease the perception of use and increase access to substance-free activities with some peer leadership and pro-social events. And so you can kind of see they're working on all different levels, from knowledge and awareness shifts to environmental shifts to policy shifts. And then Bonnie, I think you're next.
Excellent. Thank you, Jenna. And good morning, everyone. My name is Bonnie Holiday. I'm with the Office of Behavioral Health. I'm the Persistent Drunk Driving Law Enforcement Assistance Fund grantee manager. That's a mouthful. So a little bit of context on that funding stream is both the PDD fund and the LEAF fund are paid for when people get convicted of a DUI. There's a fine that's assessed, and then that fine goes into a pot. And then it's two different funding streams that come together. And a little bit of context is even before the pandemic, we saw that the fund was decreasing. Both of the funds were basically built on 1980s dollars, which don't do the same thing in 2021 that they did back in the 80s. And judges also have the authority to waive the fine. So I think the average DUI, last I saw, cost someone a total of about $13,000. So I think when judges are, making the call on what to assess and what to not, they usually, it looks like, have been waiving the PDD fine. So our funds have been dwindling, but we're in year 5 of 5, and our 3 communities have been doing great work. I think something I'd like to highlight is just how diverse different communities in Colorado can be. A lot of my communities through this PDD LEAF program are in rural areas. And so impaired driving prevention looks very different. In Denver, we have, if you're out on Blake Street, you can, get on your phone, get on your Lyft app and be home safely very, very soon. In our rural communities, that's not really an option. And so, to demonstrate this, we have Celebrating Healthy Communities. They're a community-based organization based out of Durango, Colorado. So that's in Southwest Colorado. And they also have community partnerships to serve Dolores and Montezuma counties. And so for some context, Montezuma County, that's Cortez, that's where Mesa Verde is. And Dolores, it's kind of right between the two, and it's beautiful. I'm actually a former Dolores County resident. And at the beginning of the 5-year cycle, they did some assessments and some focus groups, and they found, that there was a very low perception of harm in terms of impaired driving, that there was a perception that people wouldn't get caught. And after being a Dolores County resident, I can understand where that perception comes from, because it's a very large county. And sometimes you might even only have one officer, on duty at a time. And an interesting finding that came from the focus groups and was later, I think, substantiated by a survey they did, was that several people said that if they got pulled over in Dolores or Montezuma County, it was very likely that instead of getting a ticket, the officer would ask them to leave their car, lock the door, take their keys with them, and then would give them a ride home. Because I think in Dolores County, to book someone, you actually have to drive through 2 other counties to get back to the county seat. So just a little bit of context there. And so Celebrating Healthy Communities, definitely had their work cut out for them. And so they created the Ride Responsible program in a lot of our rural communities, rural resort communities. I think Michaela's going to speak to this. Community events, festivals, gatherings, beer gardens are really big economic drivers. And Celebrating Healthy Communities just saw a need to promote healthy and family friendly activity in these events. So they worked with the city of Durango. So currently, if you want to apply for a special events alcohol permit in Durango, you have to have basically a ride responsible agreement where you're going to designate where people can find sober rides home. You're going to designate where people can go for family friendly areas. And it really, they're working on changing the norm. COVID is, provided a lot of challenges on a lot of fronts, but I think kind of the biggest event every year in Durango is Snowdown that's happening in February. So I think we're really excited to, finish this off with a bang of this 5-year cycle. And Julia, if you could scroll forward. And actually, I'm gonna go out of order. So one more, and then we'll go back to Mountain Youth. That way Michaela can talk. Another grantee through PDD LEAF is Partners Mentoring of Larimer County. And they actually picked this contract up about halfway through the grant cycle. So traditionally they've been a mentoring agency, but there was a need to provide these services in Larimer County. Another community partner that had the grant went out of business, so to speak. And so they picked it up and they started or continued hosting a local no DUI coalition. So they brought together different stakeholders. You have basically dispensary shop owners sitting right next to law enforcement at the same table, which is always fun and creates great discussions. And then I think a limitation that a lot of these communities were seeing was with traditional impaired driving prevention messaging. They saw high rises, they saw things that looked like I-25 and 225 at rush hour. And that's just not like what every community looks like in Colorado. So they used some focus groups to create a local campaign, and it's really around helping people make safe and healthy choices. So I think it's called the Make the Call campaign, and it's about making that good judgment call and deciding if you've had enough or helping a friend get home. And then Partners Mentoring of Larimer County has also done a lot around responsible retailer programs, and also the TenderWise program, which is responsible retailers, but for dispensaries. And if you could, again, go out of order back to Mountain Youth. Thank you. And I think before I turn it over to Michaela, I really want to thank this group. In the last 3 years that I've been in my role, I've used your publications heavily. I've shared them with my grantees. They've been really, really helpful. I've used the data points at dinner conversations, so thank you for that too. And I also wanted to amplify what Jenna said, that a DUI crash, it's not something that happens out of the blue. There's a lot of systems at work. There's a lot of things going on in that individual's life. And I think when we come together and look at these shared risk and protective factors, we not only make our roadways safer, but we also keep our communities safe. And I'm so excited that Michaela's on today. She's been part of the project longer than I have, so I'm going to turn it over to her.
Thank you, Bonnie. Mountain Youth, we are a nonprofit in Eagle County, and we serve the Eagle River Valley. We've been fortunate and grateful to be grantees of both CDOT and the PDD LEAF funds. And so I've worked with the communities that Jenna and Bonnie just shared, and have been able to learn from them and share similar strategies. As Julia had mentioned, strategies across multiple areas are really having greater impact across the 6 CSAP strategies, and really look at how we are working with our community in multiple areas. So upstream, we're doing education with our youth, and then education with our families around the social norms that we have in our rural resort community around substance consumption. And then with that, we have done stakeholder interviews and some community assessments that have really highlighted for us the social norms around excessive alcohol consumption, as well as impaired driving, with statements of "you're not a local till your first DUI," or "there's no alternative transportation options," or it's just not seen as much of a concern. And so we've been working to address some of those attitudes, as well as look at what are some of the infrastructure pieces that will improve creating healthier choices. And so following along with celebrating healthy communities, we have looked at a safe ride program, and we're doing it through two different ways. One is a bus pass program with retailers, so providing them with a bus pass for any patron that they would like to encourage to get a free bus ride. Does follow, but at least gives them an option. And as part of that, we've been working, so parking is really a challenge in our community, and there are not many places where people can leave their vehicle without it being towed. And so we've been working with property owners around concentrations of retailers to allow overnight parking for anyone that utilizes that bus pass program. The other is an event safe ride program. So we do have a lot of community events and events that are structured around promoting alcohol consumption. And so we've been working with our local towns and licensing boards to figure out a way to encourage event producers to have a safe ride program agreement in place, and that is with the Eagle County Transit agency. And so utilizing our local resources to improve how people get to and from these events in our community. And then the other project that we wanted to highlight here is that we've been working with our county public health and our GIS department to create a map of our alcohol outlet density, as well as some of the other data that Jenna talked about with Gunnison County. So it maps the on and off premise retailers in our community, and as other layers that we put onto it have been access to transportation close to those retailers, access to parking, especially overnight permissible parking, where DUI stops have occurred in our community and in proximity to those locations, as well as the proximity of those locations to our schools, parks, libraries, so youth centers. Other areas I wanted to touch on is that we work closely with our law enforcement agencies. We have 4 different agencies in our community we work closely with around retailer education and responsible practices, as well as doing educational compliance checks. So ensuring that their staff know all the processes and prevent sale to minors, as well as bar checks to support with any impaired or unruly customers, as well as preventing people from leaving and driving impaired. And I think that's all that I'm going to cover today. There's a lot more that we do, but I think we'll let other people talk now.
Well, first off, I want to say just a huge thank you to all of our panelists and everybody who shared data and project stories with us today. I know this was really interesting. It was really great to see multiple perspectives on the data, from kind of a outcomes perspective on the results of impaired driving, as well as a prevention perspective. I see that Peter dropped a link in the chat box to the website where you can access SEOW resources that have been published around alcohol policy. But at this point, I would love to open the floor to questions. I see we just had one come in from Darren. I will go ahead and ask it. Darren said, great presentations. In Allison's presentation, I saw the arrest numbers for 2020 and 2021 were down to just over 16,000 for each of the years, down from 20,000 arrestees in the previous year. What do you think is the reason for the drop in arrests?
Yeah, I can't speak to 2021 as much, but definitely for 2020, we saw that during the pandemic, there were periods of time when agencies just went on accident alert status, and so that limits the amount of proactive patrolling that agencies do. So we think that's one of the main reasons for 2020. And actually, that's one of the things we want to gather in our 2021 or for our data looking at 2020 is looking at like why there was still this decline in 2021. Often with just arrests, it's just what our agencies prioritizing in terms of enforcement. So it's, and we're kind of seeing that general trend that like agencies are not prioritizing DUI enforcement as much, even though the threat of impaired driving is increasing. Oh yeah, no problem.
Any other questions?
I wanted to add so that drop in arrests also impacts the PDD funding, because if no one's getting arrested, no one goes to court, no one gets convicted, no one pays fines. So those drops also kind of create a ripple effect where the funds drop too.
That's a great point, Bonnie.
Yeah, this is Darren. I thought it'd be easier than just typing my question. Do you think that, I know a lot of law enforcement agencies around Colorado are losing people to law enforcement? What kind of impact do you think that has had?
Yeah, I definitely think that probably plays a role too. Yeah, the staffing shortages. Yeah, and I think too, we're just having a different, I feel like right now we're having kind of like a different debate about like what is the role in law enforcement in our community. And I think that's also kind of like playing a role. And I think that's like kind of like a needed step, because we definitely like know that certain communities are over policed, and we want to make sure that impaired driving enforcement does not kind of create some of those other associated harms that we have seen too. It's definitely complicated.
Thank you.
Oh yeah, I guess if there are no other large group questions, our group did have some conversations, had some questions for just the general audience. Yeah, and we just wanted to get into small groups to kind of discuss and gather some feedback from you all. And so the questions, yeah, thanks, Vinny, for putting them up on the screen over here. And we kind of talked about like the first two in our initial breakout discussions. And we're wondering if there are any additional concerns or significant factors associated with substance use in your, or impaired driving in your community. If you wanted to share any of those. Then what are the biggest barriers to measuring, understanding, and implementing change around impaired driving? And then what resources and or support would you need in order to do this work? And this last one in particular would be really helpful for our state's prevention efforts. So we're going to break it up into groups, and we will.
And I will share in the chat box. It looks like Sydney beat me to it, but if you could take notes in your breakout groups, if each group could assign one individual to take some notes on your responses to the questions, that would be very helpful to our presenters in making sure that, since we won't have time for everybody to share everything that they talk about in their breakout groups, that the presenters can reference those notes to inform them afterwards. So Sydney, do you mind sending us all out to the breakout groups? as people transition back into the room, I would love to have a couple volunteers who are willing to share out anything that their group discussed that stood out to you. I know in my group, something we touched on right at the very end as we were running out of time to kind of explore it is the limited data around social acceptability of impaired driving in terms of thinking about contributing factors. You know, there's convenience, but also thinking about, you know, is there data that across different age groups to support, you know, different levels of acceptance of impaired driving, as well as just this continued focus in sort of day-to-day life of folks thinking of impaired driving as just alcohol impairment rather than polysubstance or cannabis or other. I know we had somebody point out that most prescription drugs a lot of them come with warnings about operating heavy machinery, including automobiles. So those were some of the things that came out of our group. And I would love to hear anybody else, either from my group or others, volunteer to share.
I think the other thing we talked about was some of the barriers with data collection and having to go to multiple agencies or sources without right now really a centralized location. And then also the use of DUI citations as an indicator of success in a community can be challenged just based off of agencies' capacity to conduct DUI shifts and stops, and may not always be the right indicator for us to use.
Oh yeah, I think just in addition to that, we talked in our group just about like the timeliness of the data, especially since some of it just requires court cases to reach disposition and for all the data to get compiled from all those multiple sources. And that really reduces our ability to utilize data in real time. And we also just like talked about the challenges with the pandemic and how and its impact on law enforcement agencies, health departments. It really pulled a lot of resources from this area. And we are now in this period where we need to try and like bulk up our like systems and also facing challenges of like lack of staff capacity. Oh yeah, and then we also like in particular wanted to commend Sarah for her work looking at like the different like person types involved in a crash and how that like information is really important for us just to understand the risk factors involved for people in those different types.
So I'll share one of my questions in the discussion we had was, you know, we had looked at this issue several years ago through the SEOW. We had an alcohol policy work group, and we're trying to figure out where do we needed to go. And we had presented some stuff to state folks, but didn't get much traction. So it was thought that maybe the strategy was to go to the local people in terms of policy. But turns out, sounds like we still need to do some work at the state level in terms of addressing this. We still have one of the lowest tax rates on alcohol in the country. But I don't think we should be giving up. And there will be some opportunity because there's going to be a pretty big bill that'll be coming out in draft form here in the next day or two, but is going to be looking at imposing an impact fee on several substances, including alcohol. That is sort of like a tax, but it's supposed to be an enterprise and not a tax. So we may see something there that might change some data. But we have the interim study committee on opioids and other substance use coming up this summer. And if there's a few folks here, the data folks that want to put together some of the key highlights of the data around this, there'll be an opportunity to do some presenting. I think we still have to put this issue in front of legislators to consider what these options are, and then show examples of how this has worked elsewhere in other states. So anyone who might have an interest, we may be able to pull some people together for just a couple of sessions and then see what we could do to present this data. That group would convene over the course of the summer. So it could be July or August that a presentation or more than one presentation could be made with recommendations as well.
Thanks, Jose. And I think that really kind of brings up a great point, which is that, you know, we hope that people continue to engage with the data presentations that we do in these meetings and find ways to continue to stay involved in the issues that are most important and prevalent to their work. Does anybody else have anything that they would like to add or share before we switch topics a little bit? Doesn't seem like it. So in that case, I would just like to hand over the floor to Peter. Yes, Peter, you are still here. I couldn't see you. Just to share some updates on the SEOW needs assessment that was conducted and what our next steps there will be.
Yeah, thanks, Shana. So I'm sure a lot of you are aware that we did a needs assessment in the fall. So you probably saw a survey come to you. Thanks to everyone who completed that. Sydney, you can go to the next 2 slides from now. So I just wanted to give you a little overview of where we are in the process and what you should see coming your way soon. So we did surveys, and then we also collected interview data from a few local public health associations, as well as a few of the task force members, the Substance Abuse Trends and Response Task Force. And then we convened a roundtable with other SEOWs in Region 8 and got some good information from them about their current structures and their strategies. And so we looked at those different types of data and shared some initial findings and needs with the steering committee. And the steering committee prioritized certain needs based on their feasibility and importance, we felt, for supporting the work of our partners in substance use. So that just happened on Tuesday of this week. From our different data, we identified 14 needs, and then the steering committee prioritized 5 of those to carry forward. And we also had a discussion around essentially what is the SEOW already doing to fill that need or support that need? What are we doing that we could modify or change? And then what kind of new efforts might we undertake to address that need? So Sydney, you can go to the next slide. Our next steps will be to complete a full report to OBH, and then to send to the larger SEOW will be just a highlight, short 3 to 4 pager of the assessment process and data, and that'll come out in the newsletter. Hopefully this month is our plan. And then we'd like to give SEOW partners a chance to comment on the prioritized needs and recommended strategies. And so Sharon and I had discussed kind of like an opportunity over a week or so just to provide comment if you have any suggestions based on what the steering committee has decided. So those kind of 2 latter things you'll see coming your way within the next couple of weeks. And I think that's it. If anyone has any questions, happy to try and answer those as well.
Thanks, Peter. Does anybody else have any other member news or announcements to make before we close out this session? All right, it doesn't seem so. So in that case, I'd like to thank everybody for coming today. I'd like to give a huge thank you again to our entire panel for putting together all of this data, sharing it all with us. I know it was, I thought it was a really great discussion from a lot of different points of view, and sparked a lot of thought, food for thought moving forward for some of my own work. And so we hope to see everybody back here in a couple months. And if you don't have the recurring calendar invites feel free to reach out to Sydney and she'll make sure to get those sent to you. And otherwise, we will see everybody in March. And thanks for your time today.
One quick question. Are those slides being shared with the SEOW? And if they're ready for public display, if they could be shared, that'd be great.
Jose, I'll be sending them out with a follow-up in email either this afternoon or tomorrow.
Super. Great. Thanks so much.
Great. Thanks, everybody. Have a great
Thanks,
rest of your week.
everyone.
Bye. Thank you.
Bye.